with just a great team, which includes the Director of Division of Public Health, Dr. Carol Rattay, who's been doing an outstanding job with her team at Public Health as we continue to meet the challenges that we face as a result of the COVID-19 pandemic. The last 7 months have kept us all very busy. So let's go right to the data dashboard and talk about where we are in our state in terms of hospitalizations. We'll talk about new cases by county. You see here the new total for positive COVID-19 cases in the state, approaching 25,000. Sadly, 668 total lives lost. Again, each one a precious life, a grandmother, grandfather, father, mother, brother, sister, friend, family member. Our hearts and prayers go out to their families, individuals that have passed across our state. Again, mostly in that very vulnerable population of our senior citizens. One area of concern over the last couple weeks is the rising cases of hospitalizations. You can see our current number there at 107. Several weeks ago, we had hit a low point of about 40 or so. 107 is a bit concerning, and a lot of those cases, disproportionately the number of those cases and hospitalizations are coming from the lower part of our state, from BB in particular. We were on the phone yesterday with the hospital administrators to hear reports from each of those, and Dr. Tam from BB talked about the high number of COVID-19 patients in his hospital, as well as a number of his patients that have come in for procedures and tested positive and were not able to follow through, at least at that time. So an area of concern, and it does point in the direction of Sussex County, not any one in place in particular there in Sussex, but higher levels. If you follow our data dashboard, you can go to jump to locations, which is on the My Healthy Community website, and find out what the cases are in a particular town, zip code, representative or state senate district. It's got, or by county, it's got really good information to look at where the cases are at the local level. So those cases in Newcastle County, over 12,000 now. Again, the cases in Newcastle County over the last 7 days have kind of flattened out. They're lower. That's a good thing. The surge that we saw several weeks ago in the University of Delaware seems to have passed us by. Thank God. Don't want to spike the ball there, but some really good cooperation between the University of Delaware, the City of Newark, our teams in public health, and AJ's team with the Delaware Emergency Management Agency. AJ and the law enforcement folks meet every week to talk about the situation off of campus and parties and that type of thing. And this past weekend, things were very positive, and we thank the students, we thank the University of Delaware, we thank City of Newark, and in particular the cooperation among those various law enforcement agencies and administrative agencies as well. Kent County, a little bit higher. It's pretty steady in Kent County in terms of hospitalizations, though those hospitalizations at Bay Health are about their typical normal number as reported yesterday. And so Kent County is pretty normal there. And Sussex County is where we're really seeing the surge again. Maybe it's overstating it to say that it's a surge, but just higher case numbers in western Sussex County and many of the towns there in Sussex. So as you look at the percent positive, we've been talking about the new methodology for calculating more accurately the percentage of tests that are positive. You can see the methodology that we have been using, which is a calculation of the percentage of persons testing positive. So your denominator would be the number of those persons, and your numerator would be the positive cases. And so as we continue to test people more than once, they drop out of the denominator, and you don't have as accurate a picture as to the spread and the relevance of this really important measure of positivity. So we're presenting both of these for some period of time. If you think about it, if you eliminate So I've been tested now 3 or 4 times, and each of the times that I've been tested after the first time, then I'm not in the denominator anymore. We're testing teachers as they go back into school and educators, and then we hope to test a quarter of the staff in the schools each week, so everybody gets tested in a month, and obviously all of those tests will fall out of this calculation. We have a slide, I think, later that shows the total number of tests that we've done, and then the total number of percent or the persons that have been tested, and you'll see the big difference there. So the number of new cases per day, again on a 7-day moving average, is 132, higher than where we want it to be. We want it to be solidly under 100, and we're flattening out now, which is a good thing. We'll show a broader history of these positive cases in a couple slides to give you an idea where we've been and where we are now and where we want to go. Again, the distribution of the positive cases per 10,000 population by age group, continue to see that young adult age group from 18 years old to 34, that continues to separate itself as the highest rate of positive cases, and we've talked about that in the venues and social events where a lot of that transmission takes place. So let's look at the 14-day and the 90-day picture here. On the top row, you have hospitalizations. You'll see in the middle the new hospital admissions are trending down, which should bode well for us in the week and weeks ahead because there won't be as many people admitted each day. You would think, given that the hospitalizations has been rising and then stabilizing here at a high level, around over 100, as you see in the first graph, the top left, that middle graph would be look similar or even rising, and so we know this is a lagging indicator, and hopefully that middle graph will help with the number of hospitalizations going forward, because it's an area of concern as we move more into flu season and more people need hospital attention there. The top far right is the new positive cases. You can see, and if you look at this on a day-to-day basis, it tends to be very lumpy, some peaks and valleys on a day-to-day basis, and that's mostly a function of the testing regime that we have out there. The University of Delaware is doing surveillance testing on Tuesdays and Thursdays. It does kind of vary week to week based on the weather and such, and our large testing operations tend to be a little bit episodic. And so you really do have to look at the 7-day moving average, which is the blue bars, and that's pretty consistent, and it's consistently at a level right now where we're higher than we want to be. So on the bottom, you can see the difference between the calculation of percentage of persons testing positive, so that denominator is smaller, and therefore the overall percentage is going to be larger, and then the percent of tests that are positive is the middle graph on the bottom, and so that's a smaller number. The last one is just the percentage of emergency department visits. It shows with influenza-like illnesses, which are the symptoms of COVID-19, another indicator. So taking a look at the 90-day view, you can see where we have come from after the reopening in June and early July, with the little uptick in hospitalizations that we've experienced over the last couple weeks here on the top left. And the top middle, the new hospital admissions, you can see again, it's a little bit lumpy, and now we're on a little bit of a downward trend, which hopefully is a good thing. Positive cases, new positive cases, top right, has been, we kind of hit a low there in July and August, which is probably the low point of new positive cases going back to the first positive case in March. And then the uptick in early September after the Labor Day as the students went back to colleges and universities in Dover and in Newark, and we've seen that, and we'll see it again in a minute with a broader view. And then again, the two calculations of persons testing positive in the bottom far left, and the middle, the percentage of tests. So all the tests that are given, whether it's to someone who's never been tested before or someone who's been tested multiple times before, that's the more important measure there in the middle. And so let's take a look at where we've been. Rolling it back to March and April, you can see the peak right there around early May in new positive. This is the graph of new positive cases. The goal back in May was to follow the guidance of the Centers for Disease Control, the White House Task Force, so that as we shut down sectors of our economy, put in place stay-at-home orders, and really protected the spread in our community. You can see it peaked around early May, and then as a result of the shutdown orders started to decline. Once we had 14 days of improving conditions, lower positive cases, lower hospitalizations, lower percent positive, you can see that rundown into phase one's reopening in early June. We had a very good period through June and the beginning of July, and then we hit, if you'll remember, another little bit of an uptick in surge as we were into phase two, and that's the 4th of July weekend, and thereafter, mid-July. This graph ends at July the 22nd, and then we pick it up there in the latter part of July, and you can see how we had really the low point in terms of the number of positive cases. On a day-to-day basis, our percent positives were strong there as well, meaning low. We had not been testing people for the second time quite yet. That would come later, and so that was another factor in having a low percent positive. And then gradually we started increasing again as we moved into the fall, with the concern about the return of the virus, with the return of flu season right now in late middle to October, and so we've seen that a bit of an uptick. So the question for us now is, where do we go from here? The answer is we want to have fewer cases on a day-to-day basis. We want to have lower percent positives, meaning fewer people testing positive of the people who get tested. We want to make sure that people across our state, particularly in the areas where we're seeing a little bit of a surge, in Sussex County and some of the towns, particularly in western Sussex County, people wearing masks, protecting others by wearing masks, keeping socially distant, being careful of large gatherings. Dr. Rattay will talk a little bit about weddings and other social events and funerals and that type of thing, which feel like there's the kinds of things where your heart goes out to those folks getting married, to parents involved and all that, and friends, and you want to participate, but you just have to be careful that COVID-19, this virus, doesn't care whether it's a wedding or anything else. We might be tired of COVID, but COVID isn't tired of us, and it's out there, it's in the public, and if we're going to continue to reopen sectors of our economy safely, if we're going to continue to be safe here in our state and be able to protect our vulnerable populations from COVID-19 in what will be a new normal until we have a vaccine or a more effective treatment, we've really got to take this to heart and redouble our efforts to take the protective measures that are necessary. We look at the data dashboard on personal protective equipment. We've been looking for gloves for a couple weeks now. I'm told by A.J. Shaw that we have orders coming in today and tomorrow, so next week we should have all of these beakers fully up. We talk each week about the school reopening criteria. We're still solidly in the hybrid minimum to moderate community spread. You hopefully saw it in the graphs that we just presented in terms of where have we been in March and April, May of last spring as we closed the schools, as we got better through after the shutdowns into the summertime in July. I got really better into early August, and then a little uptick as we went back to school, and still very positive results with the districts that have been doing hybrid. It's difficult, and my appreciation and thanks to all the educators and parents who are really struggling through this and making it work for the children. Because if you're in remote instruction, that means you have the challenges of getting the children, particularly the little ones, connected and online and ready to go and pay attention to what's happening if it's a teacher coming in remotely to that home or to that child care facility. And we just need to be a big team there as we gradually reopen, and we're seeing that in districts here in Newcastle County, from Appoquinimink to Red Clay to Colonial to Christina, and to Brandywine. Yesterday, I was down on the Eastern Shore of Maryland, in Hurlock, Maryland, announcing this assistance program for our family farmers in our state, basically, which are the backbone of Delaware's poultry industry, agriculture. Delaware's number one industry, and when you talk about it, agriculture in Delaware, you're basically talking about poultry, and when you talk about poultry, you're talking about those family farmers and farms from Gumbar to Seaford to Kent County and down over to the eastern side of Sussex County. And so there are hundreds, thousands of those individual growers. Many have been very seriously affected by the disruption in the supply chain. Part of it was due to some of the challenges that we had among poultry workers. You'll remember in the latter part of April and May, challenges in getting healthy workers into those plants. And so some of the farmers had to have longer layouts, and that just basically means more cost to them and less revenue, fewer turnovers. And so this poultry grower assistance program will go right to those family farmers, those growers that are the backbone of this industry. I was delighted to be with Governor Hogan yesterday. It's a program that both the Ag Department in Maryland worked together with Secretary Skuse and Deputy Secretary Bounds and their teams in developing an assistance program for our family farmers and growers in Kent and Sussex County. We've also going to announce today, and Secretary McGarrick is here to talk about relief grants for healthcare organizations and businesses, $100 million of CARES Act funding to support this sector, a very important and hard-hit sector during the last 7 months. So we look forward to Secretary McGarrick's presentation there. And congratulations, special congratulations to Kimberly Stock, who's our Delaware 2021 Teacher of the Year from Thomas McCain High School. Kimberly, congratulations to you and to all your colleagues there at McCain and across Red Clay. Thank you for the great work that you're doing under these difficult conditions. We want a special thank you to Alex, Sussex County youth who rounded up 627 pounds of food that were collected through a neighborhood food drive. So Alex went out and collected all this food and made it available to the food bank. Just a great work of one of our youngsters looking out for his neighbors and working together to collect food for people that are in need. So thank you and congratulations to Alex and so many Delawareans across our state who are stepping up to help their neighbors in need. So with that, I'd like to turn it over to Secretary McGarrick to talk about the relief program for healthcare companies and organizations.
Thank you, Governor. Thank you so much for the opportunity to be here today. So like other industries, we know that healthcare, as well as other providers that partner with the Department of Health and Social Services to serve the people of Delaware, have had an extremely challenging year, not only balancing the regular services, but also dealing with the uncertainty and the many changes required by the COVID-19 pandemic. And to face that pandemic, they've had to expend money and other resources during a time when the entire economy is changing and revenues are dropping across the board. And so while there have been other sources of funding available, both at the state and local level, we've heard directly through conversations with our providers that at times this funding has still left gaps and unaddressed needs. And we also know that we have communities in our state that have really borne the brunt of the pandemic, and it could be because many in those communities work in frontline industries where they have repeated contact with the public. It could be the types of places they live, such as areas of our state where we see large numbers of multi-generational families living together, or it could be due to the continued impact of what are called social influencers of health, which we know can lead to poor health outcomes, even in regular circumstances, not during a global pandemic. And so that's why today I'm so excited to announce an additional $100 million of federal funding to support the providers and entities to address gaps and continued needs, whether they be for telehealth equipment, personal protective equipment, environmental modifications, or again, to help individual communities be resilient in the face of the pandemic. And so to be eligible for funding, we need folks to obviously follow any state and federal rules around how the money can be spent. But again, we are looking for areas of spending that have not been addressed through other funding sources. And so we have targeted 6 broad categories of spending. First one being intellectual and developmental disability providers, home health care agencies, nursing homes and assisted living, behavioral health and medical providers, hospital systems, again, as well as communities and their resiliency efforts. And where we're going to start, and the first wave of funding is going to be through with the providers for those adults with intellectual and developmental disabilities. And so in terms of the specific spending categories that we hope to address with this funding, again, looking for technology upgrades, personal protective equipment purchases, environmental modifications, a resiliency fund, which we are going to partner with Division of Public Health and Healthy Communities Delaware to really identify community providers and partners who are working in communities to address needs created by the pandemic. And so Healthy Communities Delaware and Public Health will work to provide application and implementation support to make sure that these entities are able to abide by the requirements of the federal funding. And we also want to ensure that this message is communicated far and wide so that communities know that this is a source of funding for them. And due to the fact that we've already seen roughly $10 million of funding go to efforts with communities in Newcastle County, we are trying to focus these new funds on Kent and Sussex counties. And then we've heard repeatedly from home health, intellectual developmental disability providers, as well as behavioral health, assisted living, and long-term care, that the funding available at the federal level has really not been enough to address the specific needs of these industries. And so we are going to target these providers for what we're calling network integrity support, again, to address the gaps and needs that have been created by the pandemic. And so I'm sure the big question everyone has is what's next and how do we get the funding? So right now we do not have an application ready to go that will be coming in the next few weeks, but we wanted to provide this update today to have providers who believe they're eligible based on the categories as well as the subject matter of the funding we're trying to address to really start getting their paperwork in order. In terms of receipts, if people have already expended resources to purchase equipment or to adjust the footprint of their location, put up plexiglass, et cetera, to really start getting those receipts together. Again, providers, we've heard a lot that especially behavioral health providers have really had to rely on and enhance telehealth opportunities to be able to reach their communities and the people they serve. So again, any of those expenses that have already been incurred or planned efforts that will be purchased and equipment that will be purchased before the 30th of December are eligible for this funding. So get your receipts together. And in terms of forthcoming information from our department, again, we will have an application and we will be providing more information on funding limits as well as a timeline for distribution and spending of the funding. And so additionally, for providers, we are going to have some additional categorization of the funding. And so for providers who are eligible and want to apply for network integrity payments, they will not be eligible to also apply for the categories around personal protective equipment. So all of this will be made clear and we will have support for individual entities to really figure out where they fit in this process and what is the best way to apply for funding. So for the intellectual and developmental disability providers, we do hope to have the application up by Friday or early next week. And again, they will be the first wave of funding for us. So for those who have questions, you can email dhss_caresquestions@delaware.gov. I would urge entities to wait until you are able to see the application and the guidelines because we think that is going to show you a lot of the information that you need as well as timelines and other things to keep in mind as you're applying. So this is just a really exciting opportunity. Thank the governor and his team so much for their leadership and their support as we look to try to find a way to work with providers and entities to really make sure that they have what they need to continue providing services during an extremely challenging time, not only for our state, but our country.
So thank you very much, Secretary McGarrick. Obviously, each of these agencies and organizations and businesses are important partners to the state in providing services to vulnerable populations and other healthcare services to the people of our state, and really important partners over the last 7 months. And so they, for lots of different reasons, need assistance with the great work that they do, whether it's for personal protective equipment, whether it's for revenue that they hadn't received, or services that they aren't being compensated for, all kinds of different challenges that they face. So send questions to DHSS _cares questions at delaware.gov and find out more information about it. I suspect that we'll be hearing from a lot of our partners on this. Next up, we have Dr. Carol Rattay, who's going to talk a little bit more in depth about some of our data and some of the what she's seeing there in the data on a day-to-day basis. Thank you, Dr. Rattay.
Great, thanks so much, Governor. So, like I want to start with talking about what we're seeing in the data. As Governor Carney already said, we're holding steady right now for really the past couple of weeks around case counts and percent positive with both metrics statewide. But we continue to look closely at, in smaller geographic areas, specifically the zip code level data, to see where we might be seeing either ups or downs in the data. So as Governor Carney mentioned already, in the Newark area where we had much higher case rates, certainly late August and September, that area really has cooled down quite a lot at this point. And even some of the other zip codes in the Wilmington area and Newcastle that we've kept a close eye on, we're seeing some decreases in case rates over the last couple of weeks, which is a good thing. But we are seeing increases in several areas downstate, and we continue to see some higher levels of activity in Greenwood, Bridgeville, Seaford, and Del Mar. We also, this past week, have seen some increases in Milton and Selbyville, as well as Felton and Frederica in Kent County. In fact, when we look at the county-wide data, although Kent County case rates are the lowest in the state, and they have been all along, this past week we saw our highest increases in Kent County. So we're keeping a really close eye on Kent and Sussex right now. AJ Shaw's not with us today, but AJ and the DPH team together have set up a number of testing sites in Kent County and Sussex County, especially on the western side of Sussex County this week. So we really want to encourage community partners and individuals themselves to really get the word out and take advantage of the testing that's available right now. As always, the more testing we can do, the more cases we can identify and isolate, the better we can do in decreasing the spread of this infection. A couple other things to mention on the data. We just want to share that we are working on some updates for our school dashboard. So look to see those updates this time next week. As we mentioned before, it's really important that we update our data as things evolve. We've updated our percent positive methodology, so the new dashboard will reflect that. But it's also really important that we feel that this dashboard accurately reflects the spread of community infection. And additionally, we're going to be providing some added features that will allow people to delve into a little bit more detail, some of the details that we look at to make decisions on a statewide and a county level each week. So that's coming next week. And additionally, I just want to, again, emphasize our testing numbers. This past week, we went over 500,000 total tests administered. So we're now at 515,000 tests that have been administered since the beginning. The last 2 weeks have been big testing weeks for us. We had over 30,000 tests this past week, which we're really proud of. We look to all of you to help us keep those numbers up. Again, the more we identify cases, the better we can control this. So keep an eye on the testing website and testing options to take advantage of the many different options that are available in our state right now. Also on our My Healthy Community website, we have now for the past 3 weeks been posting information about venues visited by our cases. So our case investigators will ask cases where they had been in the previous 14 days prior to their becoming infectious or developing symptoms. Doesn't necessarily mean that this is where they acquired the infection, but we ask them what high-risk settings that they had been to. And on the next slide, we show that, again, and consistently throughout the months that we've been looking at these data, restaurants are the most common venue that our cases have visited in the 14 days prior to their diagnosis. But I really want to point out that we've seen a lot more cases and outbreaks related to religious services and weddings. In fact, 2 pretty significant outbreaks related to religious services and 2 pretty significant outbreaks related to weddings. Additionally, we're seeing, high numbers of indoor events and house parties, and we can't emphasize enough how incredibly important it is to be cautious and to take precautions, especially when indoors, and really avoid indoor gatherings as much as possible. For any indoor activity, if you're with people who are not your household contacts, you got to wear a face covering and you got to social distance. And when we see people not social distancing and we see people not wearing face coverings, and especially in indoor settings, we are seeing story after story, case after case, cluster after cluster of infections that are spreading through these non-compliant activities that are indoors. And finally, I want to provide an update on our vaccine planning. As I mentioned last week, I'm going to provide an update every week. Some weeks we'll have more to share than others, but we did submit to Centers for Disease Control this past Friday what we're calling our playbook. So it's really the scaffolding to build a plan for vaccine implementation in our state. And we're now at a point where it's critical that we work with a variety of different partner groups. We have a task force that's going to begin weekly meetings starting this Friday. But we have other groups, for example, the Hospital Preparedness Coalition and an ethics committee that we're going to be working very closely with as we complete the components of this plan and enter into the execution phases of our vaccine campaign. We've talked before about this being a phased approach. We know we're only going to get small amounts of vaccine to start with, and it's going to be important that we allocate these to the most critical populations, guided by recommendations. There is a committee of incredibly smart and talented scientists called the ACIP. And the ACIP is meeting at the end of this month, and they are going to come up with some more final recommendations on prioritizing the vaccine, so who should get it first, as well as they'll be looking at the science from those vaccines that are in their clinical trials right now. So we'll be looking very closely at the ACIP for their findings and their recommendations. Additionally, we'll be receiving and providing technical assistance on our immunization information system. This is going to be a pretty complex piece to this campaign. It's going to be really important that we're able to very accurately record the information about which vaccines people receive, where they receive them, are there any side effects, et cetera. So for us as a state and with our many partners in the state, the expansion of this DelVax system, which many people are familiar with, for this campaign is a critical component of the work we're doing right now. And we will continue to keep a very close eye on all of the studies of the vaccine trials and the vaccines that become available to us, ensuring for all Delawareans that the vaccine that is distributed in our state is safe for Delawareans. And with that, I'm going to hand it back to you, Governor.
Thank you very much, Dr. Rattay. The whole discussion and the planning around vaccine and how we would roll it out here in Delaware is so critically important. All the estimates that I've seen don't suggest that it's going to be next week or the week after, anytime soon. The sooner, obviously, the better. But in the meantime, we need to continue to take the protective measures to keep Delawareans safe and to keep the spread of the virus down to a minimum to moderate level here in our state, so we can get more children back in school in front of teachers, and we can get more businesses more fully open. We can protect people, particularly vulnerable populations. One of the things that we need to do, continue to do to achieve those objectives is to make sure that everybody gets tested. So know your COVID-19 status. Doesn't matter if you've been tested once or twice or 3 times. Get tested again. You're only as good as the day that you had your last test, because you could go out the next day or just after that and run into somebody who's COVID-19 positive and have a challenge. Our ability to react to upticks depends on getting ahead of folks that are spreading the virus, and we know that so many are not symptomatic but are shedding the virus. We're learning that more and more. In our conference call this morning with the City of Newark and the other mayors across our state, the mayor of Newark made a plea to make sure that we continue to test in Newark, and we will, so that they can follow those indices. And in particular, they have local ordinances that restrict business activity in the City of Newark based on some of our criteria, and so it's important that we continue to test, and we will there, as we will at the University of Delaware, with their students and faculty, and with our own teachers and educators as they come back in school. One of the things that we haven't talked about today is COVID Alert DE, which is our app that provides you with a real effective tool to alert you to whether you've come in contact with somebody who's tested positively for COVID-19. This is anonymous on your part, on the part of the person that has tested positive. Just an alert that goes out via your cell phone and just gives you an idea that maybe you should get tested or quarantine yourself. We have over 50,000 people who have signed up. It's only as good as the number of people who signed up, and everybody needs to remember that it is anonymous, and folks don't know who you are, and you don't know who tests positive, who you came in contact with, other just that it happened if that person triggers it through their participation in the program. We are coming into flu months, or the flu season, I should say, so make sure you get your flu shot. Get your flu shot today, flu.delaware.gov. Get some information there about it. One of the concerns that we have with the rising number of hospitalization cases is additional people that would need hospital services that come down with the flu, and obviously we want to be able to, the hospitals need to be able to treat all of those patients. So again, thank you for your cooperation, for leaning into this. We're at a very critical stage as we move into the fall. More people moving indoors. It's getting colder outside. So a lot of the things that helped us during the warmer months are going to go by the wayside to a certain extent. We're going to try to allow restaurants to keep those outdoor spaces in a way that's safe and protects their customers as well as everybody else around the restaurant. And so please continue to follow the mask-wearing guidance and other social distancing. So with that, I know we have folks here in the room. We have some pre-submitted questions to answer as well. Thank you, everybody, for joining us. Please.
How are you,
Thank
Governor?
you. Good. Thank you for joining.
Thank you for having me. Is it true, Governor, that your office sent a cease and desist letter to TV stations airing political ads from Trans-Perfect Associated Group Citizens for Transparency and Inclusion? If so, why, and what was specifically inaccurate about the ads?
Yeah, so the ads are considerably inaccurate. There's a whole list of things I'd be happy to talk to you about later. Yes, it wasn't my official office, but my campaign office did send letters to those so that the Delawareans did not have a misunderstanding of some of the issues discussed there.
Okay, we'll reach out to your campaign about it. I wanted to actually have a question for all three of you about the election and mask wearing at the polls. We spoke to an election official recently who told us that it's strongly encouraged but not required to wear a mask at the polls. Is there a reason for this, I guess, why this is allowed, and are there other exceptions like this?
Well, one of the things that I've tried to do over the last 7 months is not become personally involved in these decisions that affect elections, as I've said time and time again, because I am on the ballot. Obviously, we have worked, and it's an important part of my role to make sure that the election process is fair and safe. And from a public health perspective, and I'll defer to Dr. Rattay, we would recommend that people wear masks. The administration of elections is done by the Department of Elections, and they make those decisions based on recommendations from public health. But it just makes sense. The reason that we have just for this election a vote by mail program until the legislature, if and when the legislature would extend it, is so that people could do it safely, so that they don't put themselves at risk by going to the polls and possibly exposing themselves to somebody who's COVID-19 positive.
Wearing masks is so incredibly effective for decreasing the spread of the infection. So from the public health perspective, we strongly urge anyone who is either working in a polling place or going to vote in a polling place to please wear a face covering.
Can I ask a question about the flu? Does the state have a way of tracking the amount of people that get flu shots in the state? And is there like a threshold that we need to reach in order for it to be effective?
So it's a great question. We do have a variety of ways in which we can try to keep track of flu vaccination. The great thing is that vaccinations can be provided in many different places. So primary care, pharmacies, supermarkets, public health clinics, and flu events, of which there are a number. Tracking it can be a little bit more challenging, and it can take several months before we have accurate information. We do a survey every year, and typically Delaware gets around 50% of Delawareans vaccinated, which is actually better than many other states, but clearly we would love to see 100% vaccination as it is so important.
Thank you so much.
Thank you. Thank you for coming. And I know we also have some pre-submitted questions, which we can take now.
All right, first question is from Cody Decker at WRDE. Similar question to before, there have been Republicans running commercials over the sale of land in Frederica. The transaction report was also released. Do you have any comment on the sale and why it is not an illegal sale?
Well, first of all, anything said in a political attack ad 2 weeks before an election ought to be viewed with a critical eye. As governor, I don't involve myself in those kinds of transactions. In fact, the first I knew of these set of transactions that are part of this political attack ad was when I saw it or heard it in the ad. I did contact the Department of Transportation to make sure that the process legal requirements were followed as they were. They released a public statement about how all those took place, and it was very clear that it was done by the book. With respect to, I think, if you think about it, I think one of the allegations is somehow there was special treatment for those involved in these sales. Those people that were involved in those sales are now suing, bringing a lawsuit against DelDOT, which I think speaks for itself about whether they feel like they got special treatment in those transactions. With respect to taxpayers, I mean, my record is pretty clear on that. We changed the way that we budgeted by limiting operating budget growth and setting aside an additional reserve fund, which has served us really well during this COVID-19 pandemic and enabled us to get through this budget season without raising taxes or cutting important programs at a time where we wouldn't want to do that. And we also set up what's called GEAR, the Government Efficiency and Accountability Review, which promotes government efficiency in our state, and we'll continue with those efforts.
Next question is from John Hurdle at WDDE. Are some companies interested in moving from big cities to Delaware to reduce their employees' exposure to COVID-19? If so, do you have any examples, and is this an economic development opportunity?
Yeah, so we have examples of that happening prior to COVID-19. Companies who were displeased with the high cost of living, higher taxes, particularly in Metro New York City area, and continue to move employees to our state. J.P. Morgan Chase is a company that comes to mind in that respect. They like the environment here. I think their employees enjoy the quality of life, the lower cost of living, and they are, I think, the largest private employer in our state as we speak. We do believe there's an opportunity there. There aren't any specific examples that I can give publicly, but we are promoting that concept and promoting Delaware as a place that's less densely populated, that's got lower taxes and lower cost of living, that's less risky in the time of a pandemic. It's got a great quality of life and a really strong workforce, and we'll continue to do that over the next series of months and years.
Next question's from Sean Green at WDEL. In response to gathering limits and restrictions, some Delaware high schools have made the choice to not allow any parents at games. What would you say to a parent who is frustrated they can't watch their child compete?
Yeah, I have a lot of sympathy for those parents. One of the great things about being a parent, I think, was maybe the most exciting thing that I ever experienced in my life was to watch my children do something and do it well. It's just like, wow, that's so cool. Whatever, play the piano, play an instrument. I remember when my little guy was in middle school and he ran out on the field with his trombone. The trombone was bigger than he was, It was just like, wow, that's my boy out there. And so I feel for parents. When I was in Congress and couldn't get back to Delaware for some of my son's nighttime games that, break my heart, I'd be have the phone open the whole time back, getting the play-by-play, but we're in a period of COVID-19, and it's just those kinds of gatherings create really, really risky situations. I know each school is a little bit different, as I've talked to the superintendents, and I think maybe a little bit different outside and inside. I know that some of the schools are allowing maybe just both parents at a football game, and some of those plans are just now coming in. But it is a concerning thing, and I think it's an opportunity to set the tech crews in the high schools loose and allow them to film the events and have them projected in the gym or the auditorium, and I know schools are doing that. Dr. Rattay, you want to comment on that?
Yeah, it's a really challenging situation, and I agree that, very sympathetic having a high school soccer player in my family, and I know that it's challenging. I know I've heard from an athletic director that, right now they want to get the kids back playing, and I think once they feel comfortable that they can do that well. I think we may see more schools allowing spectators among those who aren't right now. But we can say that I think one of the biggest challenges we've seen all along with youth sports has often been parents not wanting to social distance and face covering and wear face coverings and really looking at these as social activities. So I can see the perspective of schools where right now they just want kids to get back to playing and they don't want to be kind of monitoring some of these aspects. So it's not an easy situation for sure.
And that last point is really an important one, right? Is that the Division of Public Health in particular went to great lengths and great efforts to try to come up with an approach that made it safe for the young athletes to compete again. And, and that's, I think, a big accomplishment. And, but there are obviously risks and limitations with this on the spectator side.
So last question from Sean Green at WDEL. As a follow-up to the previous question, where does DPH stand in the process of approving schools' plans for larger gatherings and outdoor events, most notably football?
Received a large number of plans, and they've all been reviewed, with the exception of 2 that required resubmission because of some questions or things that needed to be resolved. All have been approved at this point. So we are well on our way in finalizing plan approval for fall sports.
Very good. That's all the questions for today. Thank you to Secretary McGarrick for her great work, for being with us today, and for announcing the relief funds for really our important partners, healthcare organizations and providers across Delaware, from our hospitals to nursing homes to in-home care, just incredibly important partners in the work that we're doing over the last 7 months. Just a reminder about the relief funds for our poultry contract growers, the family farmers in Kent and Sussex County who are the backbone of our poultry and agriculture industry in the lower part of our state. We have some funds based on a program developed by the Maryland and Delaware Departments of Agriculture, and we would bring that to your attention. Remember to download COVID Alert DE. It's a really effective tool to alert you to the possibility of coming in contact with somebody who's COVID-19 positive and maybe putting you in a difficult situation, certainly one where you should get tested and quarantine and be safe. And we looked at the view of the spread of the virus here in Delaware going back to March and April, and we saw where we've come from, how we've improved, how we've followed the public health guidance all the way through, flattened the curve, limited the spread of the virus in our communities. We saw surges in the beaches, bars, and restaurants in mid-June, late June and July, and we saw a little bit of an uptick as schools, as our university students went back to school. And now we're at a really critical stage where we can continue to see our cases go in the wrong direction, as many states, if not most states, have been doing, including states that had us on quarantine lists, on and off quarantine lists during the summer. Now they're not even meeting their own quarantine gating criteria. We want to get better. And the way to get better, the way to get healthier is to follow the rules with respect to wearing a face mask. It is the number one thing that everybody can do to protect the people around you. If you're shedding the virus and you don't have symptoms, you don't know that you're positive, making sure you get tested, even if you are not symptomatic, on a fairly regular basis, and just being careful and cautious in social gatherings, mostly where when you kind of let your guard down. Maybe it's a wedding, maybe it's a party, birthday party, or whatever, family and friends get together. We're moving into that kind of a season with Halloween, with Thanksgiving, with the holidays coming up, and it's going to be critically important that we're careful so that we prevent the spread of COVID-19 here in Delaware. So thank you for joining us, and we'll see you again next week.